today's conversation is quite big. How does the health system work in Australia? And we're doing this because in order to be effective consumer reps, it's really useful to understand how the health system works, and it's quite complex and multifaceted. And by understanding a little bit about how it works, we won't be able to go through all the ins and outs, but a little bit about how it works helps you be a more effective consumer rep. Australia's health system is really complex. We've actually got a really good, effective public health system when you compare us around the world. So that's really exciting. However, there's always more that we can do to make it better. We know that we can make it better, and it's about continuous improvement. And the way we receive healthcare in Australia is a mixture of Australian-wide systems and then state-based systems. So that's what I'm going to be really focusing on today, how those systems work and who is responsible for what. And to also give you the heads up that health is quite big. So most of the work that Health Consumers Queensland does is on the health service delivery. You know, how do we get healthcare in Queensland? But there's also a whole other range of parts to the health system in Australia. There's the regulation of health professionals. There's the accreditation of health facilities and training providers. For example, the universities that do all the training of all the health professionals in Australia. There's a whole system that governs that. There's also another whole system that governs health and medical research in Australia and Queensland as well. Then we've got the complaints system, which also cuts across both state-based complaint system and across into Australia as well, with the AHPRA, the Australian Health Professionals Regulatory Authority, is an Australian-based regulatory system that takes complaints of health professionals. So it ties into that first stop point. And then there's the health service delivery. So consumer reps can and do get involved in all those other aspects of the health system in Australia. And for the purposes of today's very short presentation, I'm just really going to be focusing on health service delivery. So in Australia, and probably around the world as well, you can divide healthcare into primary care, secondary care and tertiary care. Now, a lot of these slides might be a little bit fuzzy and might be a little bit small for you to view. They've all come out of our guide for health consumers, which you can get online. So you can get that online. We'll put a link into the conversation, and we'll also put a link in to the email that we send to you afterwards. So primary care is that sort of first step into health. You're sick, you're not sure what or why, you go to your GP or in some cases a remote area nurse, and you can receive primary care. From there, and they're also the gatekeepers into our health system. From there, the GPs determine have you got something that needs to be investigated by a specialist, and then you might get an outpatient's appointment into secondary or tertiary care depending on the specialty. And so it's important to understand who runs each of those parts of the health system as well, because it's not a whole seamless enterprise. And so that when we talk about integrating healthcare, it's really talking about integrating healthcare for consumers across the primary, secondary and tertiary care sectors, as well as across community care as well. So the way a person might step through all these different parts of the health system, we've got a patient's journey here that you'll be able to have a look at more closely in the guides. But basically, it's a story of a man who was having some chest pains, and he went to the GP, so into primary care, which is funded by, mostly funded by the Commonwealth through the Medical Benefits Scheme or Medicare. The man's GP said you need to be referred to a cardiologist, so then he gets jumped into secondary care. The cardiologist had both visiting rights to public and private hospitals, determined that James did need some immediate hospital care, James's health insurance, private health insurance, didn't cover him into the private hospital system because it didn't cover cardiology. So he was referred into a hospital in Queensland run by state government. Now that hospital was actually a tertiary facility as well. So the difference between secondary care and tertiary care is that tertiary care is again more specialised, might need specialist equipment. And so for instance, if you have a heart attack in Queensland and you live in Central West and you go to Longreach might then have to send you to another centre for you to get a stent in place. So that's where that tertiary care happens. And then James, after his time in tertiary care facility, came back into primary care and care back at home. So that's how a consumer might move through all the different phases of the health system. Now, the Commonwealth is largely responsible for primary care. They fund the medical benefit scheme and the pharmaceutical benefit scheme here in Australia. So that means that Greg Hunt, who is the Minister for Health for the Commonwealth, the Australian government, is ultimately responsible for the way that that system operates. Secondary care and tertiary care in Queensland is largely funded through the Queensland government, through the state-based hospital systems. We also do have private hospitals that provide secondary care as well. And I'm not entirely sure, but I think most tertiary care is done in publicly funded hospitals. So knowing who's responsible for the bits of the pie that you're working in is really important. But the consumers who sit in primary health, PHN consumer groups, they're really looking at that primary care part of the health system. For consumers who are sitting on hospital and health service consumer groups, they're really looking at this secondary and tertiary care part of the health system. So they're quite different, and what we are trying to do is integrate them. And there's lots of other elements that are part of our health system as well. So if you go to the GP, sometimes your GP might be able to bulk bill you, which means the Commonwealth Government is paying all the costs that the GP incurs for your care. Sometimes you are out of pocket, you have to pay some of that fee yourself. There's also Aboriginal and Torres Strait Islander community controlled health organisations that operate across Australia and across Queensland. They provide mostly primary care, and those organisations are community owned and community controlled, and a lot of their funding comes from the Commonwealth. Some of their funding sometimes comes from the state as well, so there's a little bit of a mishmash there of funding. Community care is provided by all sorts of providers across Queensland. Some of these are for-profit, some of these are not-for-profit, and some of them are also provided through state-based hospital and health services as well. Then we've got the public hospitals, which are funded by the state government, and private hospitals, again, similarly to community care, is both a mixture of for-profit and not-for-profit. So all of these different organisations who provide health services to us have different governance models and might involve consumers in different ways, but they can and do all involve consumers in some way, shape or form in helping them to determine policy, practice, medical care pathways, all of that. Having consumers who have an understanding of that flow of consumers through the system is really useful and important. And so I think that, and allied health, I think it's important to mention. Allied health in Queensland is often done in the primary care sector, and that is nearly all done privately. So you might go see a podiatrist to get some orthotics, you might go see a physiotherapist, and so you will be responsible for funding that yourself. So that might be you using your own money for that, or you might have some private health insurance that offers you some rebates for some of that care as well. And allied healthcare is also provided in the hospital system as well. And there's different ways of accessing that as well. So that is a very short, sweet summary of the way we receive healthcare in Australia. The next consumer conversation, we're going to be really focusing on Queensland Health and the way the department and the hospital and health services work together to provide care for consumers across Queensland. But this is that sort of whole of a bird's eye view of the health system.